So glad you guys could join us today with Tony Caito of CareSource. And we're going to do a product overview. You know the drill. If you got a question, you put that in the question box. So we can't really monitor the chat box so much anymore. But we'll answer questions at the end of the presentation. So put your comments in the question box. If it's a pressing issue, also put it in there and we'll jump in and talk about it. You know the drill. If you have any questions about anything and everything associated with the individual market, you can reach out to Brad and myself. Brad is the business development manager for Central and Northeast Ohio, so essentially the Columbus and Cleveland region, whereas I have Cincinnati, Dayton, and Toledo, more or less the I-75 corridor, and then I swing over to the Athens region. And without any further ado, I'm going to toss things to Tony.
Yeah, but I just want to add one more thing. I see several names on the list who were at the expo 2 weeks ago, which was a great success. So thank you all for being here. Maybe you've gotten a survey. We'd really like you to take that. The good news is we are doing it again next year in Cleveland, likely at the same venue because everybody was really happy with it. So the reason we scheduled CareSource for today is because Tony wasn't able to join because I had to move the date because of the venue by a couple of days. And so this is his shot at being able to present to you, following the expo. So I think it's perfect timing. So Tony, thanks for making it available to do this week. So thank you. So
Perfect.
fire
Yeah.
away. We might have to make him presenter again.
I got the share button highlighted.
Nice. Yeah. Oh,
So
good.
I'm ready to go when you are.
Yeah. Fire away, man.
All right.
Thank you. And I'm going to go off camera just because of bandwidth issues. So.
Sure. Okay. And
All right.
do
So
we
don't
see the
mind us.
presentation?
We can see your screen now. If you wouldn't mind, Tony, click on that little wine glass thingy in the lower right-hand corner. That's like presentation mode.
Uh-huh.
It's next
Or
to the
whatever you
slide,
do.
to the left of that slide bar.
Yeah.
Actually, on your presentation.
Just under the word CareSource.
Oh, I'm in presentation mode on the PowerPoint. Is it not showing up as such?
No.
It shows your notes and stuff.
Huh. All right. Well, let's try that again. All right. It's in presentation mode on my end.
Okay. Maybe we have to advance, Jeff. Or you know what, Tony? Go out, have it in presentation mode before you share it. That's what the issue is.
Okay. All right. See? All right. So we're going to
Unshare and then get it there and then reshare.
All right, you got the wrong guy for this. All right,
All
stop
right.
sharing.
Stop
All right.
sharing. Now get it in presentation mode and then share your screen. It helps if you have two monitors. Have it in one monitor and then share the screen. There you
We can
go.
now.
All right.
right.
We are
All
cooking
right.
with gas now. Thanks, Tony.
You're welcome. You're welcome.
Yeah.
Good morning, everybody. I hope you're doing well. I'm very disappointed in the weather. I got to drive to Indianapolis today, and I understand there's a major storm coming in, so I'm looking forward to that. But what we're going to do today is I kind of created a hybrid presentation for you all. It's a little bit of our road show, and then we're going to end up with a little bit of the heat map. Where we're going to look at where the CareSource plans are competitive and where they're not. And I like conversations. So if you have any questions, feel free to go ahead and ask them. It's sometimes, at least with me, if I got a question and I wait 20 minutes, I forget it. So go right ahead and ask as you're going. If you're going to do the question box, Brad, just feel free to jump in, especially if it's a timely question to whatever we're discussing.
Yeah, absolutely. We'll do. Jeff and I usually do that.
Okay, perfect. That's perfect.
Sure.
Okay, first thing we're going to do is we're going to look at our footprint in the state of Ohio. As you can see, we're in just about every county except for Knox. The issue with Knox is there's one hospital system and we cannot get a contract. I think Anthem and Aetna, maybe Anthem and Medical Mutual are the only carriers in Knox. We've been trying
Correct.
for years. Can't get the contract signed, so we've got that hole right in the middle of the state. But otherwise, we're statewide and have been for a couple years now. Our bronze plans. These are by far our most popular plans. CareSource has been very bronze focused for 5 or 6 years now. We were silver focused before that, and then we had a big shift. We're basically going with the bronze first. This was the plan that, and I think one of the reasons why it became the most popular plan in the marketplace is because it was a bronze plan that had copays. And now we're seeing the competition offer these. It's now the federal plan as well. But the bronze first is by far our most popular plan. We do have HSA plans in Georgia and Indiana. We don't have them in Ohio. However, good news, it's coming back for 2025. So that came from our agent councils. We do get agents that come in quarterly. They meet with our leadership, and that's one of the things that they've been pushing for the last 2 years is bring the HSA plan. So it is coming for 2025. And we have a low premium bronze in Indiana. This is basically high deductible, high out of pocket, no office copays. It's a little bit popular in Indiana. That's why we kept it. It wasn't in Ohio, so we got rid of it for 2024. And there's no plans of bringing it back for 2025, especially with most of the carriers going with the federal plan and the bronze level, which has got the copays. With the other thing that we're going to be getting rid of next year is the pediatric dental. That is no longer required, and so we're going to be getting rid of it, and it just has to do with utilization. No one was using it, so we're going to get rid of that. We're going to talk about our dental a little bit down the road here, but just know that it's available now. It won't be in 2025. Our prescription copays 25 tier 1, 75 for the tier 2.
Tony, what about people already on the plan for next year? They're going to get notification that P Dental is going away?
Yes. Yep.
Okay, good. I didn't know if there was a continuation for some, but I guess you can't do that in the
Yeah,
ACA.
there won't be a continuation. But again, the utilization on it was nothing. I mean, there was
Okay,
nothing there. So
okay.
maybe people will be upset that they're losing something they never used. But for the most part, I think it's going to be okay. Whatever. They
Yeah,
weren't using it
yeah.
anyway.
I'm sure all of our brokers on the call are selling standalone dental vision plans anyway, so that's probably the reason why.
Right. And like I said, we got a change coming for next year that I think we haven't seen before in the marketplace, and I think it's going to be popular. But we'll get to that.
Cool. Yep, sure.
Silver plans. We're competitive in the north on the silver. Basically, on the low premium silver side, most of our other ones are not. It's a pricing issue. We're just not priced well in the silver, except for up north, Cleveland, Toledo. We're right in the mix there. So low premium silver is good. The essential silver in Indiana works well. And even just the standard silver, we do well again, just in northern Ohio. Down south, it doesn't exist. Now our CSR plans, they do well. So a lot of our silver, I think 90% of it is all on the CSR side. Whether it's the CSR 1, 2, or 3, obviously depends on somebody's income. But there's nothing really special about our silver plans. Again, we're using the federal standard plans. Where it says silver all market, that's the federal standard. Ambetter has it, Anthem has it, and pretty soon, I think probably for 2025, everyone's going to have that because of the fact that they're limiting the number of plans. CMS is limiting the number of plans that you can have. So we're going to see a lot of the other plans, the myriad, go away, right? And so you're going to have to offer the federal standard plan, and then you probably can get one or two other silver plans out there. Um, Another plan that we came out with for 2024 that is very popular is our diabetic plan, and that's the one that's all the way over to the right. You can see it's got a relatively low deductible for all of the silver plans. The out of pocket, all right, the MOOP is a little high. It's got a $35 copay for primary care. It's got an 80 for specialists. We're working on that specialist copay. And we expect it to come down for 2025. Again, we heard from the community 80 for specialists was just a little high. Don't know where it's going to end up, but it'll be considerably less than 80. We have the urgent care and the emergency room. But if you look at the prescription drug copays, you can see they're relatively low as well. And we're going to get into a little bit more detail in a few slides on the diabetic silver as far as what the benefits are. But again, up in northern Ohio, Cleveland, Toledo, Akron, Canton, this plan is taken off because not only is it priced right, but the benefits that a diabetic gets are phenomenal. Now, you don't have to be a diabetic to get the plan. We do have,
Nice.
yeah, you don't. We have members on it that just want that low deductible and the copays. But for diabetics, it can be a real money saver, and we'll get in that a little bit. I guess. Oh, well, the CSR. Don't ask me why they made us put this slide in, and I'm going to insult you with it. Anybody who doesn't know what a CSR or an APTC is, you can go ahead and get off the call now.
No, Tony, because we might have a couple of new agents, so don't say
Oh,
anything
okay,
mean like
all right.
that.
I'll go back. I'll go. You want me to go
No,
across?
no, no.
Okay.
You're good. You're good on the CSR. I think they know that one, but and
Yeah,
the
yeah,
tax credit.
exactly.
Okay.
Right. You
If
want an
they took their
APTC?
FFM, they should know, right?
Well, yeah, that's kind of what we said when the marketing department said, no, we need this slide in there, and I'm like, huh? You realize we're dealing with licensed brokers, right? Gold plans, we do have them. Matter of fact, we're talking about coming out with a platinum plan for Ohio for 2025. Yeah, okay. No one buys them. No one really offers them. We're going to have it. The gold plan, we do have membership in it. It's not significant. If you're in the marketplace, you have to offer the gold plan. So we have it. Benefits aren't bad, right? We also have the diabetic gold that has sold relatively well. Again, you're looking at an extremely low deductible. The copays are much less. That specialist visit is more in line. So diabetic gold, diabetic silver is working well. Other golds, if you guys have been selling this for a while, you know that the market for a gold plan is relatively small. And I think the market for a platinum plan we're going to come out with is going to be even less. But they want to do it, so we're going to give it to you next year. Any questions on the plans at this point?
I'm not seeing any, Tony. So
Okay.
keep
Yeah,
going through.
it's pretty straightforward. Pretty straightforward.
Yeah, it is. I love grids like this because it's like a highlight summary. So really, really easy.
Absolutely. Okay, now to get into the diabetic plan, the big benefit of our diabetic plan is the prescription cost, right? So whether you're talking about the hemoglobin, the testing, the screening, um, zero cost, right? Preferred diabetic prescriptions are zero cost. Glucometers, zero cost. You get all your testing strip for zero cost. Now the Ozempics, what are those GLP-1s or whatever
Yes.
those are.
Right.
That is a $100 copay. But if these drugs are $1,400 a month, so a $100 copay is pretty attractive. So if you have a diabetic, again, I would stick with Northern Ohio, right? Basically anything north of Columbus. This is going to work really well. When you get into the Columbus, Cincinnati, Dayton area, the premium on this thing is about $120 to $130 higher than a standard silver plan. So you're really looking at the needle in the haystack where it's going to work, right? We do have some sales of it down there because it does fit, because they were taking so many prescriptions, and they were having, maybe a $20 or $30 copay for each prescription. They're now getting it for zero. And so the cost benefit analysis worked out on it, right? But down south, this plan has been purchased through a broker 100% of the time, right? Up
Oh,
north,
Tony? Yeah.
yes, sir.
I got a question. So there's maybe half a dozen of these GLP-1s. And you mentioned Ozempic, but there's like Januvia and Mounjaro,
Uh-huh.
and there's a whole slew of these, and there's even some other ones. They're like, I guess, synthetic insulin and things like that.
Hmm.
Where would a client find a comprehensive list of meds for the
Well, see, that's
diabetes?
I, you know, do I have one here? Because it's difficult unless if they're going to go on. We have a pharmacy pricing tool on
Okay,
CareSource.com,
I see.
and
Okay,
That's the
you
best one.
just need to make sure when you select the plan that you select the diabetic plan. If you just do a silver plan or just do a bronze plan, it's not going to reflect, the zero
okay.
cost, right?
Good,
Um,
good thought.
and we are going to be doing a training later, maybe sometime in July, on the pharmacy, because I've been in this business, oh God, 30 some years.
Hmm.
And there are things I'm learning from our pharmacy department that I just was never aware of. But especially on the diabetic meds, there are things called biosimilars.
Yes.
And I guess that's different than generic, where the biosimilars are identical, right? So it's basically the same drug under a different name. And so in some certain situations, we don't cover drug one, but we cover drug two, but they're biosimilar. And so it's the exact same drug, it's just under a different name. So there's some navigating that goes on. Some of these require pre-authorization. We don't cover, the GLP. Is it GLP ones? Is that
Yeah,
whatever they are?
Yes, that's the right
yeah,
term.
yeah.
Ozempics, right?
Uh-huh.
That those have to be pre-authorized because we don't cover it yet for weight loss, right? So you got to be a diabetic to get those approved. So it's under a prior authorization because of that. Um, but again, we find up north that the cost savings on the prescriptions and the testing supplies is so significant, in the
Tony, we lost you for a second. Tony, we lost you. It looks like you're talking, but not hearing it. Jeff, are you hearing it?
I don't hear him. What
Okay.
happened?
Hang on. He just texted me. Uh-oh. He said his power just went out.
Power.
Um,
Maybe he can phone
so
in. Can he phone in?
yeah, I'll tell him.
And then, sorry, folks.
Phone in instead. Let me find the number for you. Yeah, sorry, everybody. Oh, he's back on. Just getting a second
Okay,
for everything to reset.
great.
So for those of you in Cincinnati or in the southern region of the state, Tony said that higher premium by 120 or $130, things like Ozempics and those other similar meds, biosimilar medications, are might make the $120 extra in premium worth it in benefits even there. So something to consider. What just happened? I think we need to make Tony a presenter again. Sorry, everybody.
You got it? Do you want me to do it?
Looks like he already is. Go ahead, you try it. But it looks like. Um,
Okay.
Let me just come on camera. So I don't know that everybody wants to see my face, but it'll just be a break in a black screen. So
Okay.
Sorry about this, folks. Technology and weather always affects what we try to do.
Maybe I take it back. I'll take the thing back.
Okay.
Um,
I'll maybe share the screen, right? Yeah. Or our screen for a second. So if anybody wants to fill time, I'm feeling like the guy who opens for a comedian doing a little stretch. If you were at the expo, what was the best thing that you learned? So find that question box. It's a question mark inside of a comment box. And that'll be fun while Tony gets resituated.
hmm.
All right. I see one so far. Nope. That was a comment I had for Jeff. Nothing. Come on, gang. It's upper right hand corner of your screen. If not, I'm just going to assume that you loved it. Okay, Debbie, that's great. Connecting with NextBen, really great. And NextBen, for those of you that weren't there, is actually one of our two ICRA platforms um, that we've re-engaged with this year, and it's been really fantastic since the re-engagement. And that
Can
was
you hear me, Brad?
essentially,
Yeah.
you're on now, man. So
Okay.
yeah,
Yeah,
uh,
it was a half a
it
second of
happens.
a power out and everything resets.
Uh,
Is
yeah,
my screen still showing?
no, it's not. You're gonna
I
have to
took you
reshare.
back. I rescinded that. Now I
Okay.
gave you back permission.
There you go.
Perfect.
Okay. Sorry for the interruption. That's going to make the recording really fun.
Yeah, well, hey, we can't affect technical issues. You'll just have to work around it.
Yeah. Well, the sun's shining here, so there's no excuse
It
for it. So
is. I
I'll talk
was
to
thinking
First
you were
Energy.
getting a storm out there on the
It's
east side
it's
of the lake.
it's coming. I think it's going to hit you guys
Yeah,
first. So I'll
yeah,
be
yes, it
driving
will on
for
the
it this
west side.
afternoon.
Yeah, yep,
Yep.
yep, yep.
Okay. I think we went over pretty much everything on the diabetic plan. Was there any questions on it?
No, none yet. But what I did see or noticed, Tony, when you said that down in the, south of I-70, the premiums are 120, $130 higher, but just the cost saving on these diabetic medications could make it worth it
It
compared to
could.
other plans. Yeah, right.
Yeah,
So
it absolutely could.
yeah. So
Yeah, I mean, it
maybe
really
maybe
comes
it's
down
those
to a
southern
cost
brokers.
benefit
Yeah,
analysis.
yeah, that's it exactly. The numbers never lie, do they?
Nope, they never do. And I think that's why, 100% of it, south of 70 is broker sold because, the direct consumer can't do that math in their head, right? That's what we do. That's where we earn our money. So um, they were able to highlight that.
Yeah.
Okay. The other thing that is built into all of our plans is our telehealth. This is a zero copay. So it's a free benefit. I don't know if anybody else is using it, but I am almost exclusively using telehealth now. You can do it from your couch. I don't need no paper. I don't have to drive out there. They can do most prescriptions. No pain meds. They can't do pain meds except for possibly aspirin. Um, but it's fantastic and it's free, right? So you literally could call every day for every little problem that you have, and they usually do a pretty good job. You take a picture down your throat or of the lump on your skin, and it's fantastic. So I'm using it. It doesn't cost a thing to do it. So I save. I'm on an HSA plan, so I saved the $120 office visit. It's fantastic. But the other nice thing about our telehealth is it now does um, counseling, right? So not only do you get the primary care physician, right, but you can also get, um, if you're having,
Emotional issues.
depression, Yeah, whatever, right?
Yeah.
And the nice thing of it is, on the mental health aspect of it, you will continue to see the same provider, right? So, if you know if you set up
Oh,
a
great.
weekly telehealth counseling, you don't each week have to go back to, what your father did to you when you were little, right? Um, it's you meet the same person. You can, so you can get your therapy on your couch instead of their couch, and again, it's free, right? It's fantastic, and we're starting to see the utilization of both of our telehealth, for both the doctors and the counselors, uh, really taking off. It saves the carrier money, but more importantly, it saves the member money. This is all free stuff to them, right? So if you're not pushing this, with your members, you should, only because of the cost saving to them. So you get a bronze plan that's got that high deductible. Especially when you're talking about counseling, the mental health aspect. That's a specialist, right? So you're looking at either no copay or a very high copay. Zero is a lot more attractive. You can do it on your computer. You can do it on your phone. It's really becoming a very popular aspect of it. We started with zero during COVID, and we're sticking with it. We have no plans on changing it for 2025. It's still going to be zero. So that's just extremely good news.
Tony, that's on the HSA as well. It's still zero,
Yes, it is.
correct?
Yes.
And so that's the great thing about not spending money and having a plan such as an HSA or a high deductible plan. If you are dealing with behavioral health, or talk therapy, even, right?
Uh-huh.
That's really great. I think when my or my psychologist retires, I'm gonna convert to telemedicine.
Well, see, I always say I don't recommend to the men out there that you tell your wives that it's free and you can call as often as you want, because you'll never ever ever win another argument, because when you disagree, she'll
Oh,
just call the counselor and go, "He's doing it again." So you might want.
that's not true. That's not true because there's a privacy. What is that? Doctor-patient privilege. So,
Exactly,
but
exactly.
nice joke though, Tony. So you finally got one.
See, I told, just wait,
Yeah.
it'll
See,
happen.
right? Good, good. Keep going, keep going. But I think
Okay.
really great. Yeah.
Okay. Now let's talk about our dental. Um, we have on all of our plans, we have, for instance, we have the bronze first, and then we have bronze first with enhanced benefits. The enhanced benefits is our dental, vision, and fitness, and we're going to go over them all here. As we regrettably say, our enhanced plan comes with vision, a fitness benefit, and the ability to say that you have dental. Um, we're with a company currently called DentaQuest. We've had a lot of issues with DentaQuest on the network side. Um, you search for a dentist, you find plenty in your area, you call around, none of them are taking it. Um, it's good benefits, but in some places it can't be used, right? And so we have made the decision for 2025 to, well, maybe I shouldn't be telling you guys this. Oh well, I guess I already said it.
We're
Um,
not. We may not be beneficiaries, so you're okay.
there you go. We decided to get rid of DentaQuest, and what we're going to be doing for 2025 is a flex card. So
Ooh.
we've got, they're still filing the plan, so I don't know where the benefits gonna land, but I think what it looks like is where it's gonna land is for the bronze plan you'll get 500, for the silver plan, silver and gold you get 1,000, right? And that'll be included, in the enhanced plan. Obviously, there'll be no networks. You can go to whatever dentist you want. You take the flex card. If it's, you get a $100 cleaning, you just pay with it with your flex card, right? Obviously, for the savvy, members out there, you can negotiate the price or whatever. But we're going to try the flex card in I think all of our markets. So we're going to get rid of DentaQuest. We're coming out with the flex card. Um, no networks, and there's, they kind of give you how the sausage works. The actuaries are a little concerned about this because they don't know what the utilization is going to be. So that the benefits were pared down a little bit because they weren't sure. After they see what happens in 2025, if the utilization for dental stays like it currently is, those numbers will go back up. I think what we'll see is, maybe 1,000 on the bronze and 1,500, maybe 750, whatever. But they put the utilization really high, and to keep the cost in line, they limited the benefit to where I think it's going to be 500 and 1,000. So, but we're really excited about that. You get that came from the brokers. Um, we had a broker in one of our meetings suggest it. I think he kind of did it as a joke, but the market president who was in attendance kind of liked it, and so we pushed for it, and then they decided to do it. So we'll see what happens on this.
Yeah.
Like I said, I don't.
Well,
It's I don't think it's been tried before in the marketplace. Obviously, we see it on the senior market, um, but I don't think there's any marketplace plan that's got a dental flex card. So
no,
I
for
no
sure.
idea what's that.
Well, and hope that there's not. And for the actuaries, maybe they see the blip on, or not the blip, but the movement in enrollment because of it, and
Hmm.
that will negate any of the utilization.
Exactly, right. But
So
these actuaries are they're fun people, and they want to see somebody else tried it and it worked before they do it sometimes,
yeah,
and so they don't
exactly.
like being guinea pigs because they got no science to back it up. So
Yeah.
they're biting their nails on this one, but we'll
Yeah,
see what
Tony,
happens.
before you move forward, there's a really great question from Debbie,
Uh
and
huh.
she is asking if the Flex card can be used on top of any other dental.
Oh, absolutely,
Okay,
absolutely. Yeah,
just make
we're
sure you're
just
showing them
going
the right
to.
card, right? If you're going to the same dentist.
Yeah, it's going to be
Oh,
probably
that's great.
a Visa or a Mastercard, kind of like an FSA card. Um,
Nice.
so it's cash, right? The only thing that is because we have an administrator lined up, and the only thing that has to be verified is that it is a dental expense. You're not buying a 12 pack with it, right? So it's going to work, just like an FSA card. You go to the counter and they say,
Right.
okay, well, these expenses qualify for it, these ones don't, um, and deduct it. And that's part of the expectation is that our members are going to use this flex card to cover um, deductibles or copays, excuse me, co-insurance on other dental plans. But
Nice.
that,
Yeah. Wow.
that's fine.
That's a double bet, right?
Exactly.
Or double down on
Exactly.
the bet. That's good.
Yep.
Great
Yep.
question, Debbie. Thanks for asking.
So we think it's going to be popular, but we'll
Yes.
see. We'll see. Okay. Our
All
vision
right.
plan. Yep. I'm sorry.
No, no, just keep going. You're good.
Okay. Our adult vision plan, again, this is a part of the enhanced benefits. This is very popular. We use IMED. I get no complaints from IMED. No one ever calls me about IMED. It works well, right? The benefit is good. It's pretty standard. If we got any group guys out there or ex-group guys, you look at these benefits, you say, these are kind of in line with what a group would expect. Um, and so again, just it's very popular. We like to pitch it because everybody seems to like it. So we're sticking with IMED. There was no discussion about maybe increasing the flex card and getting rid of IMED because it's just so popular. And I think it's important to note that our enhanced benefit runs about $10. So if you look at the difference in the premium between a bronze first and a bronze first with enhanced benefits, you're going to look at about an average of about a $10 increase, right? It's less for the younger people. It's obviously more for the older people. But on average, it's about $10. So when you consider, um, you get this vision plan, you get the ability to say you have our current dental, and then you get the fitness benefit we're going to go over for $10. It's fantastic. Matter of fact, a lot of the brokers actually sell our enhanced plan just for the fitness benefit. So I guess we can. Any questions on the vision before I roll forward?
No, I think one other great point is if you're not noticing the $20 off the balance over 250, that's really great for those of you because iMed is owned by Luxottica, in case you didn't know, and they make all those great Italian designer frames. So you get 20% off of those very fashionable frames, or some of the extra things that you add on to your frames. So that's a really good call out.
It is. It's a great benefit. Okay,
Yep.
now our fitness benefit. We use Active and Fit. You can check the network that we have of gyms at activeandfit.com, but it's got LA Fitness and Snap Fitness, Planet Fitness. I don't know. I'm sure there's more people on this call that are like me. I donate $25 a month to Planet Fitness. I haven't gone there in well, if you saw a picture of me, you'd know how long it's been. But
Well,
I keep trying to cancel it, but you got to go up there. And I always tell the guy, I said, if I can get up there, I wouldn't need to cancel it.
so Tony,
Yes,
you can utilize that benefit without working out simply by going on the massage chair and the hydro wave chair.
I know.
And if you're planning for vacation, you could do the tanning booths as well. So that's that's what I used it for. I think I worked out there a couple times.
Yep, exactly. And that's yeah, I would get about 20 minutes of a workout in, and then I was doing the tanning bed and massage tables, and um, but I'm paying $25 a month. Uh, with this, it's free, right? This isn't a discount, right? It's not like, oh, well, now you can get the $25 membership fee for $10. It's free. You do not have to select a gym, right? You can't say, all right, I'm going to LA Fitness. You can go to LA Fitness on Monday. You can go to Anytime Fitness on Tuesday. You go to Planet Fitness on Thursday. You're a member of all of these gyms, right? There's what they say, over 7,000 of them, right? And the other nice thing about this is if you're a traveler, these are national network. So if you happen to go down into California and you're the type of person who likes to work out on vacation, well, you're a member of these gyms there as well, right? It's a national network. You also get home fitness kits. These are those rubber bands, some barbells. You get every year, right? You can order more of them and to stock the house with these type of things. They have workout videos that you can go along with. You have the access to a healthy living coach, right? They can give you information on how to work out or how to eat or whatnot. And then, of course, if you go on to Active Fit, I always recommend you do go on there and put in your zip code. You'll be amazed how many gyms there are around your
Nice.
area, right? It's just not one. In some locations, in a lot of locations, but not all locations, the YMCA's are in there, right? And so this is just a phenomenal uh, benefit that we offer. And again, you get all three of those things for the $10. Um, it's we pay an extra buck in commission if you sell it, which is not a lot, but I mean I guess it's 10%. Um, but most of the people who buy this plan, we don't see people leaving. Once they have it, they stay with the enhanced plan.
Yeah, that's great. And you know what? Even for like the out of state, like you mentioned, Tony, for those people who are using VRBO and Airbnb, and the home that they're staying in doesn't have a workout facility like a high rise or a condo might, or complex might, this is a good way to use it. Um,
Yep.
so that's really another great.
Yeah. Enhanced benefits are extremely
Uh,
popular at CareSource. All right. Is everybody here licensed?
I believe they are. I don't notice anybody that's not.
Okay, then we won't need to go over how to go get contracted. If
Yeah.
you are not using our sales support team, you are missing out. Um, One of the feedbacks that we consistently get from our brokers, whether we're at some of our agent appreciation events or the road shows, agency councils, is how phenomenal this team is. Especially I mean, if Charisse, um, if Sharice ever leaves CareSource, we're in some trouble. I mean, she's really good. And the thing I like about this team, um, and we've all dealt with it. You call a carrier and you get with their customer service or even their broker support. You get what I affectionately call the monkey on the phone, right? You go ahead, you tell them what the problem is. They look at the computer screen. They tell you what the computer screen says. Normally, what that is doing is repeating the problem without an answer, right? These people will dig, and they're like dogs on bones. Um, and they will get a problem resolved. If it can be resolved, they'll get it resolved. They're not going to tell you, um, just whatever the screen says and let it go at that. They dig into it, and the brokers are just head over heels with this team, right? They're just that fantastic. Um, so you can email them here at sales support. That goes to everybody on the team, right? So it's not a matter of just always having to have the email. And if Sharice is out, you can't get a hold of her a couple days because she's on vacation. You send it to salesport.com. Every team member gets that email, and it's jumped on right away. Um, you can call at that number, right, and talk to somebody live. 50-50 whether they'll answer the phone. If you leave a message, they'll get back to you within 24 hours. It seems to be a lot faster if you email them, right? Um, but again, if you're not using these guys, if you're especially if you're calling our customer service department, don't do that. This is the team that you want to talk to. So, I don't know how you guys. Excuse me one second.
I'm
I don't
gonna
know how
jump in
you
here.
guys handle the
Yeah.
service if you make them come to you. So then I would suggest that Cornerstone reach out to sales support, or if you have the agents do it directly, this is the way to go,
Mhm.
right?
And
You're
Yeah,
going
and
to be
that's good.
very happy.
Tony, if I might add, we do involve another partner of ours. He's an associate with the Risk Strategies. His name is
Hmm.
Jim Derrick. He does a fantastic job too.
Oh, Jim,
Yeah.
So
Jim
in
is
many cases,
absolutely
if it,
fantastic.
particularly like billing issues and occasionally a claims issue, we'll get Jim involved because he's again, very very persistent and gets things done.
Yeah.
Jim,
Eh,
Jim is, and I mean this affectionately, a pain in my butt because he is so
a
persistent,
dog on a
right?
bone.
Yeah, absolutely. When
Yeah.
when there's
Good.
an issue, Jim's on it. He includes me in pretty much every email he sends out. So a lot of times I see the conversations. Jim works it, right? Jim works it. Yeah, you do have a good one there.
Yeah. And gang, if you're on the fly, we did add a new teammate to Jeff and I. Her name is Carla, and she maintains the box. And maybe Jeff, you can type in to the chat um, that that question, or not really questions, but escalation boxes that we have, so that we may be able to run some interference for you. If you're not able to get to talk to anybody, I think within 24 hours is a pretty good turnaround time. And from my past experience, I would also say that the email is very good way to do it as well, because you're putting in the details that could be lost in a phone conversation, right? You're giving
Yep,
their name, you're giving them their member number, and you're telling them exactly what the issue is, whether it's regarding a doctor, a network, maybe even these extra benefits. That was actually one of the questions asked, Tony, was, for the gym and for vision and dental, does the broker support team, can they also answer or resolve those issues as well?
absolutely,
Okay,
absolutely.
good to hear. Good to hear.
Yep,
Great.
yep.
And
It,
hey,
it
they're onshore, right? Which is better than offshore.
that's right. That's right.
Great.
Um,
Is member
and
service offshore or onshore also, Tony? I think I got to
our
believe.
customer service is a hybrid.
Okay.
We have some onshore, we have some offshore. We're not happy about the offshore. We don't know why that decision was made. We are obviously pushing to get rid of it. Right? It
Yep.
just
Everybody
never
does.
seems to work out well. Um, but again, for the brokers, you don't need to call customer service. Right here, sales support.
There you
right?
go. Cool.
And yeah, it's always on shore. Um, again, it's we've been training these guys for several years now. And the one thing I keep bidding into their heads is if it doesn't seem right, it's not right, right? So
Yeah.
if somebody goes to they got a claim issue and they said I went and got a physical and I'm being charged $2,000. How come it wasn't free, right? You don't you don't say, well, that's because how they processed the claim, right? It doesn't seem right. It's not right. Got to figure out what happened. Um, and that's where they've really gotten good at understanding right and wrong and what needs to be fixed instead of just telling you how it is. So you'll be very happy with them. We don't get complaints. Everywhere we go, people just tell us how fantastic this team is. So reach out to
Great to
them.
hear.
It'll make your
Yep.
life easy.
Great.
Okay. Well, then here's all your broker managers. These are our cell phones, right? So right there, that's for my phone number. That is my personal cell phone number. Brad can tell you. He texts me on that phone number. I think I always respond to you. But
Yeah, except the one time. No
well,
kidding.
except the one time. You're right. You're right. You're right. You're right. You're right. All right. Fine. 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 But I like to give out my personal number because at 5 o'clock I throw my company phone away. Um, but as my wife will tell you, I take phone calls at 9 o'clock. I take phone calls Saturdays and Sundays, especially during open enrollment. I've been known. We were at a road show and a broker said, he's not lying. I actually called him 11 o'clock on a Sunday night just to leave a message and he answered the phone. So, like, anyway, my wife wasn't happy, but it was during open enrollment. We got it done, right?
Yeah,
So
but
you can
I
call
think
these
most
numbers.
carrier reps are the same, right? And when it's the high season, it's business, right?
Mhm.
And that business is an app and it's profit. So I used to do it as well.
Exactly, exactly. But yeah, you can text these numbers, you can call these numbers, you can email. We're always here for you, right?
Yeah. And I
We
always
also
think a
have
text is a great one too, just because, right? Could be in a meeting or on the road. So a text is easy to see than listening to your voicemail. So send
exactly.
a text. Send a
Yep,
text first, right? And then he'll
yep,
call you back.
yep. And if you happen to have my work phone and you call it or text it and you don't get a reply, I'm telling you, I don't look at it. So use this number right here. And then we do
There you
have
go.
a standard email to all of us. So if you email to broker managers, it comes to all three of us at the same time. So if one of us happens to be in a meeting or on PTO or on the road, one of the other ones of us will be able to get that right away.
Yep.
Now, yeah.
No,
Okay.
good. Yeah.
Oh, there we go. Let's see. Ready to sell. Okay. We don't need to learn about contracting. We don't need to go onboarding. Okay. Now, what we do every year is what we call the heat map. I don't know if I think Brad. I think you were on the heat map
Yeah,
last year.
I was. Yeah, I
And
was. It was really
I,
great.
yep, and I think you had some of your brokers that were on it.
Yeah.
This is not only becoming one of the most popular presentations we do. It's going to get better this year. We have now contracted with an organization that analyzes networks. And we're going to be able to show you not only the hospital networks, we're going to be able to show you primary cares, we're going to be able to show you specialists. So we'll be able to say, okay, in rating area 3 in Ohio, not only do we have these hospitals, Anthem has these hospitals, Anthem has these hospitals, but CareSource has 372 primary cares, and Better has 352. So you're going to get some data. And the reason why we find that important is I know you do as well, but we've had some new entrants coming to the marketplace where they have very limited networks. Their pricing is really good, um, but their networks are kind of small, right? They're more targeted. And so you're going to be able to see that, maybe, and I'll just pick on Cigna because they're the biggest, and anything negative I say about them, they probably won't feel financially. But in Indianapolis, they were so cheap 2 years ago. They had one hospital. Their primary care network was so small. People were buying it. They couldn't find a doctor because there were so few of them in it. So we're going to be adding that type of information. There's a lot more. It's going to get a little bit more detailed. I obviously can't go over the whole heat map. Now we just don't have the time for it. But I am including basically the synopsis page. We put it at the end of our heat maps. And so you can look here in the Toledo area, and this basically refers to CareSource, right? So our benefits are good, our network is good, premium is good, and overall this is a green area. You can sell CareSource in this area, right? And then we break it down with the notes, right? Showing you or giving you, basically how we came to that conclusion, right? In the Lima, you can see we're good. In Dayton, we got great benefits, we got good networks, our premium is too high. Overall, you can't sell it, right? Same for Cincinnati, right? Clinton County is the same. Erie County is the same, right? You're looking in these situations, if it's network, right? They have to have Dr. Jones. We're the only carrier that has Dr. Jones, and they can afford the premium. Yeah, I guess you can sell it. Mansfield, we got good benefits. Their network is small, on the small side compared to and this is all compared to the competition, right? But our premium is really good, so overall that's green. So you can just see the synopsis, right? Columbus, not good. When we get into Cleveland, you saw Toledo was good, Cleveland was good, Akron is okay, Worcester is really good. So that whole northern area, with the exception of Youngstown, is fantastic in Ohio, right? We're also going to be looking pretty good in Canton, Zanesville, Hocking area, right? So I guess it's basically the Southwest from Columbus going southwest. We're just not competitive. A lot of that has to do with the fact that we have the children's hospitals, and we're one of the few
Yeah.
carriers, and in some areas, the only carrier that has the children's hospitals. We have every children's hospital in the state of Ohio except for Akron. Um, but with that,
Because it's Cleveland Clinic, right? And
well,
that's the
the
main
Clinton
reason.
Clinic, yeah, no one has
Right.
besides
Yeah.
Oscar.
Yeah.
But with having the children's hospitals comes the claims,
Yeah.
and we're working on our contracts in the Southwest Cincinnati Dayton area with the children's hospitals. We're getting there. Hopefully, we can get a little bit more competitive right now, but it's a loss for us down there. So
Yeah.
we're working
Tony,
on it. We're trying to get better, but that's where we're at.
is it possible for you to share these few pages of the rating analysis area so that because there's some decent notes that we can send it up as the follow up with the recording
I'll,
of the presentation? Are you allowed
I
to?
will forward you the. I'll forward it to you. Yes.
Correct. Great. Thanks, and everybody out. And we'll be sending that out within a day or so.
All right, good. Well, I know we have like 5 minutes left, so I'll open it up to Q&A.
Yeah, there's a couple left. We already dealt with most of them in line. Well, actually, Debbie Boop has a great comment. She said she loves working with Sharice and David. So that's a great feedback to share with them.
Did you say
Um,
Debbie Boop?
yes, I did.
Boop? Boop's on the phone? I
Boop's
love
on the
Boop.
phone. I love Boop too.
She comes to our agency council meetings, and she is
Yeah,
just fantastic.
yeah, she
Uh,
is. Um, and you know what? Actually, Tony, you just said something there. Um, the meeting I first met you at last year at Fatheads Brewery, and it was
mhm.
a business meeting, everybody, not a happy hour meeting. Um, are you going to be doing those again, Tony? And are they open to most all brokers, or is it by invite?
Well, no, it's open to all brokers, right? We do limit it. We are going to be doing them again. We're going back to Fatheads. Um, Everybody seemed to like it except for that. What was it, like a 10
Bottling
minute
issue.
that where the grain was getting refilled? That was fun.
Yeah. No, that
Uh,
was the bottling in the rollers going up and down the building and around.
yeah,
Um,
that was fun. That was kind of loud, but the food was
yeah,
good.
yeah, it
The
was.
atmosphere was good, so we're going back there. I think we're limited to 40 people, so it's basically the first 40. that registers. So the invite goes out and it's first come, first serve. I will say that we normally bump it up because, right? 30 people say they're going to come, 20 people show, right? So if it's sold out, if you go to to log in and it says it's sold out, reach out to me, right? Reach out to Brad and Brad reach out to me. I'll get you in, right?
Yeah,
Because we just know that we're not going to have 100% attendance, so we go over a little bit.
correct. Correct. Yeah, that's great. When was that? Was that like July, August, September, one of those
It's
months?
September, right?
Okay.
The date. Let's see if I can.
Oh, wow.
Um,
And are they going to do them in other markets? I know you have
oh
most of
yeah,
the state, but I know. Okay, good.
in
Because I know
Ohio
we
we're going
have,
to do one in Toledo, Cleveland, Columbus, in Cincinnati. Indiana, we do Fort Wayne, Indianapolis, Evansville. Do one in Louisville, Kentucky. Um, and then we do one in Asheville, North Carolina. Or excuse me, this year it's in Charlotte because we're expanding in North Carolina. And then we do Atlanta, Augusta, and Savannah.
nice. So if anybody's getting their vacation in before AEP and OEP, and you're going to be in Charlotte or any of those southern cities, great time to take a break from the beach and go visit Tony.
Yep.
Well,
Yeah.
not necessarily just you all the time, but the
Yep.
folks from CareSource.
Yep. And when we send it out, we'll probably send it out end of July, the invites, maybe early August, probably end of July. It'll have all the dates on it. So you can register for any one or as many of the events as you want to.
Great. Last question I see. Somebody asked, are brokers able to download an ID card in the broker portal for their clients?
Yes, they are. That
Okay,
went live a couple months ago. And again, that
great.
came from complaints from our brokers that they couldn't do it. Um, and we got it done. So you can now download cards right from your portal.
Fantastic.
So great.
So
I just want
go
to
ahead,
jump
Jim.
in here. In the past, brokers used the old Calidus portal
Uh-huh.
to look at their book of business. Is the
Yep.
book of business available on this new portal?
Yes, it is.
Okay, perfect.
Wow, that's a double
Yep.
good thing.
So you can use both right now. Um, Eventually, the old portal will be phased out. I don't have a date for when they'll phase that out. I think maybe when they stop seeing people utilize it, um, they'll get rid of it.
And where do people go for the new portal? What is the actual URL if you have
Um,
it?
uh-huh. Uh, Email sales support at caresource.com.
How about we furnish
We'll
it in
put
the
that in the
follow-up?
follow up. Yeah, yeah, yeah.
Yeah.
So be on the lookout for
I,
that
I
email.
don't know the web address off the top of my head. They would
Okay,
though.
okay,
Yeah.
that's fine.
Any other questions?
No, I can't see anybody. So, gang, this is your last few minutes to get a question answered that you've been dying to know from Tony. So let's see, what else can we do? No, Tony, this is really great. I love the interaction that we have, and I just think it adds to the value for our brokers who have attended. Those who didn't just missed out on a really great show. It's almost like Laurel and Hardy between you and I sometimes.
A little bit. A little bit. This is a
um,
relationship business, right, Brad?
no doubt, no
Yep.
doubt. So yeah, so gang, I mean, if you're thinking of a question, I just wanted to say that we are going to be be sending out a survey here in the next day or two for those of you that went to the expo. Um, really like your feedback. So if you see it, just please fill it out real quick. I think it's 7 questions, really simple. The feedback that I've gotten verbally has been fantastic. Actually, not only from you brokers, but the carriers were super, super happy with the engagement. And they're all seeing all of the contracting come their way. And yes, Tony, actually, it's CareSource as well, because I did mention a couple of times that
Thank
you
you.
couldn't be there because of a scheduling conflict. So just look for that. And important to know, I said it earlier, we are going to come back to Cleveland next year. We're looking at dates right now. Probably we're going to try and bridge the Medicarians and Medicare con, because a lot of the carriers, flew on a red eye back from Las Vegas to be there. So I want to try and time it really well, either late March or sometime in between those two events. We always run that risk. I can't research every college or high school spring break in northern Ohio, so we'll do our best to have it timed. I think when we did it this time, it was late April. All of the spring breaks were probably generally over by then, except if you had a late ski trip to Mont Blanc or something like that. So um, that's it. I see no other questions coming in. So everybody, thank you so much for letting us go over a couple of minutes. I think this was engaging for you as it was for Jeff and I and for Tony. So thanks everybody for what you do. Thanks for making Cornerstone your general agency of choice. If you have any other carriers besides CareSource that you would like to add, just let Jeff and I know, and we are happy to make that happen. Or if you're looking for a transfer, not getting the reaction from your current GA, um, Tony will grant those. So thanks for so thanks very much, everybody. It was really great having you on, and appreciate it. Look for the recording and any of the follow-up material that we'll send in the next day or so. So thanks very much, everybody. Have a great day. Tony, thank you for being here
Thank you for
and
having
making
me.
yourself available. No, always. All right, everybody. Thanks. Have a great rest of the week, and we will see you at another training. I think we've got another couple coming up. So hang tight.